Hello lovely, in this short video I'm going to tell you what you can expect at your 12-week scan. We'd actually hoped to do this vlog style and kind of bring you along with us, but we were asked not to film in the waiting room and when we were having the scan. I do have a tiny bit of footage that I can insert later. But yeah, we unfortunately couldn't film it that way, so I'm going to have a sit down chat with you guys and just walk you through what you can expect at your 12-week scan. Let's get straight into it. So what happens in the scan? And first things first, what you're going to do is you're going to let them know that you're there and then probably wait in the waiting room. You're going to get then called through to have your scan by the sonographer. So you'll enter the scan room. It's usually quite dark. There's a bed that you're going to lay on and a screen that you'll look up at. The sonographer will ask you to get on the bed and lower your trousers to kind of like your pubic bone and then lift your top up. And then they will apply some kind of jelly-like cream to your belly, and they'll kind of use the probe to glide the jelly out so that it's kind of spread across your stomach area. Then the sonographer is going to guide that probe across your stomach area. It's not painful at all. They use like a really gentle pressure, which is nice. You're not kind of being like really dug into with the probe, which is good. And then you will see the images of the ultrasound on the TV screen in front of you, or if you don't have that kind of setup, you'll definitely be able to see it. The sonographer might kind of pull the screen round so that you can see it on her screen, but every time we've been, there's always been a screen sort of for you to look at, usually directly in front of the bed. So that's really nice. And I think most of the time, every time that we've had a scan, we have been sort of showed what each individual part is and of the baby, and you know, it's been really reassuring. I'm not sure if that's every scan, but especially the scans that we've had with the NHS and especially the ones that we've had privately, they do really talk you through, you know, different parts of your baby and show you different things. And I absolutely love that part. I love learning and seeing them and like figuring it out, and looking at their little faces is the best thing. Another thing that we've had with each of our scans is the opportunity to buy photos at the end. With the NHS, I think it's like 3 photos for £10, which is what we've always done. It's not the same everywhere, but where we've been with both of our babies, so with Juno and the baby that I'm currently pregnant with, they kind of give you quite a few different pictures and just tell you to pay for 3. It might not be the same wherever you're going, but that's just the experience that we've had. We've been given kind of 5 or 6 pictures, and the sonographer's like, oh, just pay for 3 when you go up to the front desk. And, you know, that's absolutely lovely. I love that. And they could still only give me three and I would pay for them. So that's a massive bonus. So that's kind of what happens in the actual scan room. So let's touch a little bit now on what they are checking for in the scan. I'm just going to add here a little disclaimer. I'm not a medical professional, and this is just information that I remember and have learnt from having scans with Juno and our second child that I'm pregnant with. So I'm going to talk you through those now, and it might not be absolutely perfect, but this is just the general idea of what they are checking for in the scan. So the main purpose of a 12-week scan is that it's a gestational dating scan. So that basically means that they can give you a due date and kind of work out roughly what age your baby is in the womb. Another thing that they check for is multiple pregnancies, so they will let you know if you're just having one baby or if you're having multiple pregnancy, which can be exciting, I guess, if you are, or really reassuring, and you can be really grateful if it's just one. Whatever you're into. I know a lot of people love the idea of having twins. I've always loved the idea of having twins, actually, but since having my first, and you know, the age gap isn't huge between them, there will only be about 20 months between them, I think them throwing twins into the mix would be a little intense. We would have made it work 100%, but we were quite happy when we found out that it was just one. Let's put it that way. And then the last thing that they're going to check for, if you opt for it, is the screening for Down syndrome, Edwards syndrome, and Pateau syndrome. I think that's how you say it. You don't have to have these screening tests at all. It's completely optional. I have had them with both of my babies just to understand them and, you know, be aware of what we're dealing with. I like to feel as in control as possible, and that for me was, you know, something that helped me felt in control, and then I could make informed decisions based on the information that we were given. With both of our pregnancies, we've been given a low chance percentage of having any of those syndromes. That doesn't mean that it's not going to happen. It's not completely ruled out, but it's given, you're basically given, like, if you opt for the screening, how did the nurse that took my bloods describe it? She kind of said it was a bit of like an algorithm. So they take loads of different pieces of data. So your scan, your bloods, your age, ethnicity, loads of different things. And they give you a chance of it happening, low, medium, or high. Both of our pregnancies have been low. I don't know the protocol. If you were received a medium or high result, that would have to be, I don't know, I guess you'd get the support if you had those answers, but we've never had those answers. So quickly, are there any risks involved in having a 12-week scan? So no, not really. The 12-week scan is not known to have any risks or cause any side effects or any complications. And then anything else at this appointment or bits that I want to add will be in this little section. So I've touched on it lightly, you will be offered blood tests. I think that they are just for the screening of the syndromes that I just spoke about, but they might be looking for other things. I actually had a blood test because I am a negative O blood group. And if your baby is positive, if your partner is positive and then your baby is positive, there can be some complications if your blood is mixed. So I have to have injections throughout my pregnancy, but I had to have those with Juno because the blood test wasn't available at that time. But this time round, I was offered a blood test to see what blood group the baby is, which is so cool. So I should get that back in the next 4 weeks. I think they said they should tell me at my 20-week appointment with the midwife. So that's very exciting, but not everyone would have that. If you and your partner are both positive blood groups, then you won't need to have that at all. At your 12-week scan, you'll be booking in your 20-week scan, which is when you find out the gender through the NHS. You can pay privately and go and find out at 16 weeks, which is what we do because we just can't physically wait. We have to know. So we're doing that actually next week, which is really exciting. Actually, by the time you see this video, we will know the gender of our baby, which is crazy. And we are very 50-50 split in this household at the moment. So that is going to be a very interesting reveal. But that will be another video. And then just a couple of other bits about the appointment. Allow a little bit of time. I think we were seen quite quickly and it moved quite quickly for us for both appointments, but we were still there for about an hour because you have two separate appointments basically. So you're seen for your scan and then you go back to the waiting room and then you'll see for your blood tests. And then you have to kind of book in the 20-week scan, book in any vaccinations if you're going to opt in for having the vaccinations. So it can be a bit of a lengthy process. So allow a good amount of time. Another thing is they say to go with a full bladder. Now, don't take this to the extreme like me. I didn't do it this time. They still said this time though that my bladder was very full. I didn't even feel like I needed a wee. But the first time I was pregnant with Juno, I read, you know, come with a full bladder. I could hardly walk. I was so desperate for a wee. And they told me to go and empty half of my bladder. Now, that's hard. Have you ever tried when you're so desperate for a wee to empty just half of your bladder? It's impossible. I did manage to do a good enough job though. They were quite happy with what I did, but yeah, don't go to the extreme like me. Just have a glass of water before and you'll be fine. That's kind of it for this video today, guys. Just a really quick one, a little what to expect at your 12-week scan. I hope you enjoyed it and I'll see you next week for another part of this series. Lots of love. Bye.